All right, we're live.
All right, good afternoon, everyone. It is Monday, May 3rd, it's 3:02 p.m., and this is the weekly meeting of the Lincoln County Board of Commissioners. We are meeting virtually. I will call the meeting to order. Next item on our agenda is establish quorum, and I'm getting feedback on that system, so I don't know what's going on. Can we have other people who aren't speaking mute? Okay, that seems to have done it. All right, we do have a quorum. We have all three commissioners present. At this time, we have several recognitions, and the first Monday of every month, we do some employee recognition. But before we do that, we are going to have a couple of proclamations, and we're going to do them in reverse order as they're listed on the agenda. And first of all, we will do the National Nurses Week of 2021. And I believe we have Jessica Hubbard and Sergeant Gaynor. And I will ask Commissioner Jacobson to read the resolution and then welcome our speakers.
All right, thank you for giving me the opportunity to read this, proclaiming May 6th through 12th, 2021 as National Nurses Week in Lincoln County. Whereas in 1974, the President of the United States issued a proclamation declaring National Nurses Week, which is traditionally celebrated the week of May 6th through 12th. And whereas there are nearly 3.1 million registered nurses in the United States, which comprise the nation's largest single component of the healthcare profession. And whereas the demand for registered nursing services will be greater than ever because of the aging of the American population, the continuing expansion of life-sustaining technology, and the explosive growth of home healthcare services. And whereas this year's theme for National Nurses Week is a vision for future healthcare. Now, therefore, the Lincoln County Board of Commissioners do hereby proclaim the week of May 6th through 12th, 2021 as National Nurses Week. And Lincoln County calls upon its citizens to honor nursing students and nurses past and present from beside nursing and hospitals and long-term care facilities to homes, to public health, behavioral health, and primary care clinics, to jails and juvenile facilities, to the military, to the halls of research institutions, state legislatures, and Congress, and will now be meeting the expanding healthcare needs of American society.
All right, thank you, Commissioner Jacobson. And I sense we have a number of people to address the board. I'm not sure who would like to go first, so I'll leave it to your group to share some comments. We cannot hear anyone. Still no audio.
Hello?
There we go. We
Okay,
can
hi,
hear you now.
Jessica Hubbard. I believe I've been made the presenter, so I'm going to be presenting a quick little slideshow on our FQHC Nurse Appreciation. So
For those in the audience, FQHC is Federally Qualified Health Center.
Yes, thank you. So really quick, I wanted to talk about something called the art of nursing. And this abstract body of knowledge helps nurses connect with patients during care and is completely reliant upon being genuine, attentive, and immersed in the moment with patients, what some call being in true presence. So some of our phenomenal staff, we have Amber Gross, FNP. She is our Associate Medical Director. We have Jason Van Erickson, FNP, over primary care. And we have Jamie Burris-Fish, APRN. She is our psychiatric mental health nurse practitioner. We also have Mary Jo Koshel. She is our primary care program manager. Anita Whitman is our VA program manager. And myself, Jessica Hubbard, I am the school-based health center program manager. Some of our other staff, for our primary care, we have Stacy Brewer-Daly, Barbara Townsend, Sarah Hack. For our we have Stephanie Arnoldson. For behavioral health, we have Cindy Moquin. School-based health center RN is Crystal Pickner. And our new office-based addiction treatment is Dawn Barr. So some of the reasons our nurses rock, their ability to jump into action with all things COVID related. We are always looking out for one another as a team, teamwork, continually keeping patient safety and satisfaction at the forefront of their practices, volunteering at COVID vaccination clinics and testing days, and ensuring clinic coverage by being flexible and adaptable. So this is a quick picture. This was our very first COVID vaccination box, and this is Mary Jo, and she's presenting it. And then this was when we first started testing patients for COVID. We had a trailer set up in the parking lot, and we were doing that. And just a couple of patient comments that we've received from our satisfaction surveys. Always treated with courtesy and care, love your clinic. Yes, I love coming to see Amber. Google Translate, excellent service and very helpful. And for Jason, many thank yous for being here. And that's it.
All right.
Thank you.
Other comments from presenters?
Well, Commissioner Hunt, I'm not on the list and I don't have a PowerPoint, but I always have something to say. Acceptable.
Absolutely.
All right, awesome. I really. This year for Nurses Week, I think nurses globally have come to. Heavens to Betsy. Yeah, I'm Shelley Pay. I'm the maternal.
Thank you.
So I'm just saying that you can't turn on the news every night and not see a nurse on the news. So I wanted to have my talk start out with, I want to thank and have a moment of appreciation for our nurses. This last year on or about March 10th, 2020, the world changed. It was a very scary time for all of us. And I have a quote that says, "It's okay to be scared. Being scared means you're about to do something very brave." And I think that was a turning point for our nurses being very brave, because we're all very brave. We all learned about COVID, even when we didn't know about COVID. We all learned about Zoom. We all learned how to live without paper, and we all learned about electronics. But most exciting was, I think, is that we all stepped into each other's world. The CD team taught us all about communicable disease and reminded us about hand washing. We have so much lived respect for the work that CD team does. Maternal child health stepped into case investigations, call center, and the wildfire evacuation setup team at the recreation center. Primary care took the lead at that evacuation center. And if you didn't go over there, that was a sight to behold. We had so much opportunity for overlap and to walk in each other's shoes. What a gift to see just how valuable each of us is. I think all of our nurses have been very brave this last 15 months. It has not been easy. It is the biggest challenge of our lifetime. And we are nursing at the same time that we are experiencing it. For all that ultimate sacrifice, I say thank you to each and every nurse of the Lincoln County Health and Human Services. And there are a lot of them here. And I just think globally, it's a huge, huge thank you for our organization.
Thank you for saying that, Shelley. That was really, really awesome speech. I'm Molly. I'm the supervisor for the communicable disease team. And so that really hit home, Shelley, about how big this pandemic has been on our nursing world. And thank you, MCH nurses, for coming in and helping us with investigations. The teamwork has just been amazing. And then the CD team himself, I can be more thankful for the awesome team that we have and how committed they are to our community and the well-being of everyone's health. And then one more shout out to our retired nurses that came back and helped us with investigations and are helping us with immunization clinics. Yes, National Nurses Week.
All right. And any other comments, or we'll open the opportunity to the commissioners?
This is Marie Gaynor. Can you hear me?
Yeah, Marie, go ahead.
Good afternoon. I'm reporting from inside the jail, so you may hear some background noise or radio. But I just wanted to recognize the 2 corrections health nurses we have here in the jail. They manage a real diverse group of patients and also all types of healthcare, which requires a high level of commitment and efficiency on their part, which they bring to the team. Their patients are often combative, ungrateful, uncooperative, and they refuse the help until they establish that nursing relationship. And that's really when they're able to do their best, is once the patients are detoxed and clear-minded enough to listen and to respond to what the nurses are trying to accomplish. The 2 corrections health nurses we have see hundreds of patients. They remain professional, they remain committed to the profession, and committed to their community. So I think this week also belongs to our 2 nurses here at the jail, which is RN Rochelle Kaiser and RN Emily Viola. We did have an incident in the jail, so Emily wasn't able to join me, but she's here. So I'd like to thank them for their professionalism and commitment, and also their dedication and hard work in making a difference in the lives of their patients, their coworkers, and their communities.
All right, well said. Any other comments before we go to the commissioners? All right, Commissioner Hall, I see your microphone is green.
Thank you, Chair Hunt, and thank you to our nurses who were able to participate today in this meeting. And really, we've been, I think, trying, we've shown recognition and appreciation for the many nurses who are part of the Lincoln County team every year. But if there is ever a time to be offering our most deep and heartfelt thanks, appreciation, and recognition, it's certainly this year, after 13 months of pandemic, the awful wildfire, and I'm glad, there was recognition of the demands that's put on our nursing team as well. But, I'm proud to call many of you friends and all of you colleagues, and it, just truly humbles, awes, and honors me to be able to have a role in honoring you. Thank you.
All right, well said. Commissioner Jacobson.
Yeah, I first want to add on to what Shelley said. She said that all of you were brave, and I just wanted to add and say brave and heroic. Heroic is really the word I would use for this past year. It has been an incredibly difficult year, and I think our healthcare staff, and specifically our nurses, have carried that burden across their backs this last year. And I just wanted to say that I see you, I see all of you, I see the year on your faces and how difficult it has been for all of you, and I just wanted to let you all know that you are valued. And we see you and really appreciate all the work that you have done for your community. The safety of this community has really been across your backs, and we thank you for all of that. And I have appreciated just all of your hard work and problem solving and creativity. And I often sort of ask myself as a straight face test, what would Molly think about this? Or what would Florence do in this situation? So, just know that you are seen and appreciated. And as much as I would love to say, I'm so glad we're done with all of this, I know you know that we're not. But just as we move forward through hopefully the final stretch, I just want all of you to know that you are seen and appreciated for the work you've done and for all the work you're going to do to help us get out of this. So a big thank you.
All right, and I will add also my words of appreciation. I remember when I first met Molly, she had this object in her hand that had a sharp point, and she took great delight in jabbing me for a vaccination, and I'm teasing. She was an excellent nurse. I hardly knew I got a shot, but that was my first encounter with many of the nurses that are with the county. And I'm going to ask all of the nurses that are attending virtually, turn on your camera and wave, please, so we know who you are, or at least those of you that are here. I see some in the background there. Yes, please. If we were meeting in person, I would ask you all to stand, and I would ask everyone to give you a round of applause. Certainly, the job that you've been asked to do is unimaginable. Many of us have been asked to address challenges that none of us would have expected in our roles, but certainly nurses and dealing with healthcare, you're most directly affected with the COVID pandemic and the challenges that it presented, and my heartfelt appreciation for the extraordinarily good job that you all have done. Words are easy, but they are heartfelt. So again, my sincere appreciation. We're not out of the woods yet, but I know that one of the reasons we in the county have had a great deal of success in controlling or limiting the spread of the virus is because of the ongoing efforts of the nurses. So again, my heartfelt appreciation. And with that, if there are no other comments, I'm looking across my screen and trying to acknowledge each one of the nurses and say thank you. So please know that you're appreciated. With that, commissioners, who would like to move to pass this resolution?
I'll make a motion proclaiming May 2 through 8, 2021 as National Correctional. I think we had a different one. Did we change that?
Yeah, I think it looks like we already scrolled ahead to the next one.
Yeah, if you could.
Yeah, well, scroll backwards. You want to scroll backwards.
There we go. All right, we scratched that motion to start over.
Good catch, Commissioner.
Yeah, I was like, wait a minute. All right, I will make a motion to proclaim May 6th through 12th, 2021 as National Nurses Week in Lincoln County.
I'll second that motion happily.
All right, I'll call for a vote. If there's no more discussion, all those in favor say aye. Aye?
Aye.
All right, again, great opportunity, and the work of you all is much appreciated. Thank you. All right, we'll move on to our second proclamation. If I can get my paperwork in order here. This was recognizing National Corrections Officer Week, and I believe we have Sergeant McDowell, at least as our initial presenter. And tell you what, I'm going to ask Commissioner Hall to read the proclamation, and then we'll hear from the sergeant and others. You're muted, Claire.
I'm glad to do that, Mr. Chair. I do have a request for our team in Master Control, though. If there is any possible way you could increase the size of the text, because otherwise this is just going to overtax. Yeah, much better. Thank you, my tired old eyes.
You know, I'm the older one.
Hey, I've been wearing glasses since I was 7.
Go ahead, Commissioner.
In the matter of proclaiming May 2nd to 8th, 2021 as National Corrections Officer Week in Lincoln County. Whereas the President of the United States has designated the first full week of May as National Correctional Officers Week, and whereas one of the primary goals for Lincoln County is to provide its citizens with an effective criminal justice system that concentrates on quality for all our citizens, and whereas correctional officers' work includes daily exposure in a hostile environment with many of the most dangerous individuals in society, and whereas correctional officers have performed their duties in a most professional and dedicated manner, while at the same time being faced with potential harm to themselves from inmates. Now, therefore, we, the Lincoln County Board of Commissioners, call upon all citizens of Lincoln County and upon all patriotic, civic, and educational organizations to observe the week of May 2nd to 8th, 2021 as National Corrections Officer Week in Lincoln County, in which all of our citizens may honor correctional officers, past and present, who by their faithful and loyal, scroll please, by their faithful and loyal devotion to their responsibilities have provided dedicated service to their communities, and in so doing have established for themselves an enviable and enduring reputation for preserving the rights and security of all citizens.
Sergeant McDowell.
Good afternoon. I'd like to thank the commissioners for recognizing the week of May 2nd through May 8th, 2021 as National Corrections Officer Week. A profession that is often overlooked, discounted, and dismissed as nothing more than a glorified babysitter's job. This could not be further from the truth. The truth is corrections officers are caring, compassionate, and brave individuals who work in a mentally, emotionally, and sometimes physically challenging environment. Lincoln County employs 37 of these individuals. Individuals who spend holidays, weekends, nights, and birthdays behind concrete walls and locked doors, ensuring the safety and well-being of those in custody and in the community. Occasionally, we joke amongst ourselves, we were sentenced to life on the installment plan. While this is a joke, it is the reality of the sacrifice it takes to work in this profession. As with many professions these days, it is not getting any easier. Societal expectations, funding, bed space, and what seems to be an ever-growing population of individuals with mental illness all lend to the increased challenges faced in Lincoln County Jail. But with that, we're very fortunate to have the corrections officers we do. They meet every challenge head on. They're open to change, flexible, and adaptive. After 14 years in this profession, I never cease to be amazed by the hard work and dedication our corrections officers demonstrate day after day, night after night. I'm proud of my profession, and I'm proud of those I serve alongside. Thank you for your time.
Thank you. Sheriff Landers, anything you'd like to add?
Sure, I'd like to add something as actually came to mind as this was being read by Commissioner Hall. The part about daily exposure in a hostile environment with many of the most dangerous individuals in society, which is true. But there are also a number of individuals, as we have become aware of, that have a substance use disorder, a mental illness, or other behavioral health issue that is in jail. And I think, as Sergeant McDowell put it, it's the compassion and the dedication that these officers do for these individuals that have made a difference in a number of lives. And I think that's, really the true testament to what our staff does in the jail each and every day, is they're changing lives. And, we're seeing it all the time. And, well, sometimes it takes a little more work than others, but I know several individuals around the community that come up to me and thank me for their time that they spent in jail because of the individuals we have working there and for what they learned from them and help them get on with their life. So, that's where it really comes down to. We got in this occupation to help people. Yes, there are dangerous people in our jails, and we have to be aware of that. But it's really helping the individuals that we can help, and that's the most important thing. And the largest majority of them are those individuals. So I just want to commend them for the great work in doing that also.
All right, thank you. Comments from my fellow commissioners. Commissioner Jacobson, I'll let you go first.
Thank you. Just wanted to extend a big thank you to everybody for their work. It's also been a challenging time for correctional officers this last year, both with trying to, reduce or minimize or not have any outbreaks in the jail, but also, as Sheriff Landers was saying, just dealing with people that have behavioral health and mental health issues. It's not been a kind year for people with mental health. I think all of us would probably say it's been a challenging year for people. So just really appreciate your work and your patience in dealing with people this year. I know it's been just a challenging year for everybody, including all of you. So big thank you.
Commissioner Hall.
Thank you, Mr. Chair, and thank you to our presenters. And Yes, I think, this is another proclamation that we're happy to adopt every year to put the spotlight on people doing very difficult, very challenging work, even in the best of times. And there's been some allusion to the pandemic. And unfortunately, just recently, we've seen our first COVID outbreak in the jail, despite, top-notch efforts at prevention. It seemed like 11, 12 months ago, we were hearing about jail outbreaks and much larger outbreaks throughout Oregon. And this one, has been dealt with as swiftly and professionally as possible to minimize its spread. But, again, that's just one of the thoughts at the forefront of my mind, is that as if this wasn't a challenging enough job, now the staff has to deal with the everyday specter of COVID as well. Thank you.
All right. Well, I will add my appreciation for all of the challenging work that these correction officers willingly do daily. I think there are a couple of parts of the proclamation that really resonated with me. One is where it talks about concentrating on quality for all of our citizens. I think that is certainly a phrase that is highly applicable to our county and to our corrections officers. And I also liked a phrase at the end, who by their faithful and loyal devotion to the responsibilities have provided dedicated service to their communities and have established for themselves an enviable and enduring reputation. Again, I think those words especially apply to our corrections officers. And I think it's important to realize that these corrections officers, as has been noted, they face challenges every day. And I'm sorry, I'll confess, when I was a little younger, I actually did some babysitting. And I have an opportunity to babysit a grandchild or two. And I tell you, the idea that a corrections officer is nothing more than a glorified babysitter is the furthest thing I can think of when it comes to what is truly their job and the burden of their responsibilities. So again, highly appropriate that we take some time each year to recognize the job that the corrections officers are doing, and the especially good job, in my opinion, of the good job that our corrections officers in Lincoln County are doing. So again, my sincere appreciation for the good work and the good results. If there's anything else, otherwise I'll entertain a motion.
Mr. Chair, I would move that we adopt this resolution proclaiming National Corrections Officers Week in Lincoln County, May 2nd through 8th, 2021.
I will second Commissioner Hall's motion.
And I'll call for a vote. All those in favor say aye. Aye.
Aye.
Before we move on, I'll just say it really seems that both of these proclamations were especially noteworthy, as has been said before, and put in view of the times that we've faced in the last year or so. So again, thanks to all. All right, again, one of the things we do in the first meeting of the month is to recognize employees that are celebrating their 5-year anniversary or multiples of 5 years of service to our county. And each one of these individuals will get a certificate that is manually signed by all 3 commissioners, no digital use of signatures on those certificates, and a lapel pin. And I believe some of these people are present, but I'll start with, and I know her as Gingy. I think most of us know her as Gingy. And Gingy has served us for 5 years. So thank you, Gingy. I do not believe you're here virtually. Molly Murphy in the Transit Department, thank you for your 5 years. I see Molly, she's waving. Hello there, Director Bruce in the background. And Jerry Herbage, our own Assistant County Counsel for 5 years. Yay, Jerry, thank you. Angela Hoke, Community Service for 15 years. I don't believe Angela's here, but again, thank you, Angela, for your 15 years of hard work. And this gentleman, I'm going to take just a moment to comment on. It's not usual, or it's unusual that we recognize an employee of 30 years on his last day of work. But earlier today, we recognized Lieutenant Cameron for 30 years of service in the Sheriff's Office. Most recently, he's overseen the patrol side of the Sheriff's Office. And again, a heartfelt appreciation for your 30 years of service to the citizens of our county. And with that, thanks to all of these employees. I believe if I do my math correctly, quickly, it's about 60 years of service. So thank you all.
Commissioner Hunt, I think Angela showed up in the background there. I think I see her with Director Campa. Thanks, Angela.
Are you there, Angela? All right, sorry I missed you. Yes, you're there. Oh, and you have your certificate and your lapel pin. So thank you for proving me to be truthful. All right. With that, we move on to, again, the first meeting of the month. We recognize new hires. And I believe Nicole from the Personnel HR Department, there she is, will provide introductions of these people.
So I was gonna have everyone turn on their camera, but it doesn't look like we have anyone that's listed here on the meeting, but we'll still go ahead and go through intros. So we
Please.
have- Sorry, the printer's going on right now, so you may not be able to hear me.
You're fine.
So we have Julie Turner. She's at the Sheriff's Office. She is a contract employee and a nurse over there. We have Sydney Ewing. She's also at the Sheriff's Office and also a contract nurse. And then we have Ian Lilly. He's with Health and Human Services and a case manager. And then Ann Flores with Finance. She's our new accounting specialist in payroll. And Jeffrey McAllister in the IT department as our new computer technician.
All right. Welcome to all of those new employees. And again, I encourage you to come and see the Board of Commissioners again soon. Don't wait for 5 years. And you're always welcome and certainly encouraged to reach out to individual commissioners when you have an interest. So we welcome you to the county and wish you the best of luck. All right, if there are any comments, commissioners, before we move on? Seeing no mic, oh, Claire, you turned your microphone green.
Yep, that was an accident. I just, I can only echo your welcome, Chair Hunt.
All right, again, thanks to all. All right, we'll move on. Next item on our agenda is the adoption of the consent calendar. These are items of a routine nature or items that have come before the board previously. At this time, if a commissioner or staff wish to highlight an item, you may do so. Otherwise, I'll entertain a motion to adopt the consent calendar as presented.
I'll make a motion to adopt the consent calendar as it is presented.
I'll second that motion.
All those in favor say aye. Aye.
Aye.
That motion carries. I guess I should have said the other motions have carried too. They've all been unanimous. All right. Next, we have a decision action item. This is a resolution extending the declaration of emergency related to COVID-19. Council Belmont.
Commissioners, Wayne Belmont, County Council. And yes, we've done this before and hopefully we'll maybe not do it too many more times after this, but this is the extension of our declaration of emergency for the COVID pandemic crisis. We are trying to align with what's being done by the state of Oregon. The governor extends the state's emergency on 60-day intervals, and we're doing a little bit more than 60 because it runs up on the 4th of July holiday. So we're running it out a little bit beyond that date. To give you an opportunity, once you come back from the 4th of July holiday, there'll be a board meeting on, actually it'll be July 6th will be the board meeting, and an opportunity to see where we are at that time. I would note that if things change dramatically one way or the other, you have the ability to modify this particular declaration, which can include amending it or revoking it at any time at a board meeting between now and that date in July. So unless there's any questions, I think we can move forward to adopt this.
Questions, commissioners? Otherwise, I'll entertain a motion.
Mr. Chair, I would move that we adopt the proposed resolution extending the declaration of emergency in Lincoln County related to COVID-19.
I'll second the motion.
Any discussion? All those in favor say aye. Aye.
Aye.
That motion carries. All right, we'll now move on to the reports portion of our agenda. And first item would be a Lincoln County Public Health update. And I believe Susan is with us today. There she is.
I'm here. I will wait for the slides to pop up on your screen. Thank you. So today's update for May 2nd, what you'll see on the very first slide is our cases in Lincoln County. We finished the month of April with 145 cases. This is more than November, but still less than our highest month of December and January this winter. And we've got 7 so far in the month of May. That's just 2 days tracking for the month of May. And then on the next slide, you'll see our county risk level trends. We're in high, and it looks like we're going to stay in high as of Friday. We had more cases over the weekend that kept us in the high category. So through Saturday is what we count. If we'd had 6 fewer, we could have gone down to moderate. We're really close to that line. So it appears tomorrow we'll get the official notice we'll stay in high.
Now, Susan, I'm going to interrupt here. I think it's really noteworthy that after 7 weeks of increasing number of cases, we've now had 3 weeks of decreasing cases, which is certainly a good trend.
Absolutely. Yeah, that's a very good trend for our county. It may not be the trend in the state, but for us, we're going the right direction. On the next slide, I have a little bit more about the risk level metrics. Oregon cases and hospitalizations are actually still trending up, while the vaccinations and deaths currently are trending down. A reminder that deaths tend to happen after you start seeing that increase in hospitalizations, so we don't know yet if these are less severe cases that are hospitalized or not. We'll know in a few weeks. Crossing our fingers that they are less severe. There are 15 counties that got put into extreme risk this last Friday. And during that same announcement, OHSU showed that they're modeling, it shows that if we tighten those restrictions, that means in those extreme risk counties, not in our county, and we can keep vaccination rates at the same level they are now, we could see a return to normalcy by the end of June, which is really good news because we're all really tired of it. And we see kind of a date now appearing that we might hit that critical mass of vaccinations where we begin seeing protection for more and more people. On the next slide, you can see the actual counties that are in the extreme risk for this week. And then an announcement will be made again tomorrow about, scroll down please. There'll be an announcement tomorrow that says if any others go into extreme risk or if we stay. Could you scroll the slide? Thank you.
So we're surrounded by pretty much high and moderate, although you've got Polk County there in extreme. It's pretty much right down the middle, and looks like straight across the middle of the state right now is an extreme. And that only gets hit, as you may remember from last week, if we have 300 hospitalizations within the state, and if we had seen a 15% or more increase in those hospitalizations over the prior week, which we did last week. So we'll see if that continues through this week and if the extreme levels will be hit again. And that is determined at the state level. On the next slide, you will see the variance. I didn't highlight any others of concern. It's the same ones that we've been seeing. The ones that really increased for our region were the B117, which is that virus people call the UK virus, and the B1429, which is the California variant. Those are the ones that have been increasing in our region, which is that 6-county region, including Marion County. And across the state, those seem to be the same ones that are picking up. Although the P1 variant from Japan and Brazil did just about double in the state over the prior week's numbers. So just keeping a close eye on that one as well. And we'll see a new update on the variants this Wednesday. They update this once a week. On the next slide, unless there's questions, I want to pause. Okay. On the next slide, you'll see our vaccination trends. The state has added a trend line now to each of our counties. So you can see on that bottom right graph, that's the 7-day average of our vaccinations. You're seeing it trend down, which we knew anecdotally from the clinics not really being filled up in the last couple of weeks. So we expected that to be that way. And it's actually a steeper descent if you look at the statewide chart that's on the OHA data page. And then when we look at just the overall population, we remain at second behind Benton County. If we look at the 16 and older population, the state has added this dashboard, which I did not include here. We're at third. So we're behind Benton and Hood River for the eligible population that has been vaccinated. So we're all still really, really close. So continuing to keep ourselves at the top in the state. And if you look at that 16 and older, we have vaccinated a little over 61% of our eligible population. Our first goal was to hit 60, and then our second goal is to hit 70, and we'll keep pushing that up the closer we get. The more people get vaccinated, the better chance we have of getting that community immunity, is what they call it now, and protect each other from the virus. Next page. This is our testing data. The week of April 18th, we had 957 tests in Lincoln County, and then 716 is last week. But there may still be some testing results coming in, as the week of April 25th ended on Saturday. So we could still be getting some results in there. And our positivity rate has continued to decrease. Last week, the week of the 18th, it ended at 4.7%. This week, we're seeing around 3%, which is really good news. We want to keep under that 5% positivity rate to show that the spread is actually decreasing. So that's good news. On the next page, we talk about the vaccines that are coming this week. We actually ordered fewer vaccines than what you're seeing here. In fact, I think we may have gotten more Moderna. I wasn't able to get this data reviewed by Florence today because she's been in those HHS director interviews. But this is what we had planned on, and it turns out they're getting more. I think North Lincoln Fire received 1,000 vaccines today, and I think we may have received 600. So next week, we're likely not going to be requesting any vaccines. As you can see, we still have some on hand, and we're getting more this week, and we don't have the demand that we've had in the past. The goal, of course, is to use these vaccines within a week so that they don't go bad too quickly, and so that the areas of the state that require more vaccines, if they're having trouble getting people in, we can ship more vaccines to the counties that really need it right now. So those are first doses, and then the next page is what we're getting for booster doses. Not too many, because this is what we had received maybe 4 weeks ago or so. So we're getting the resupply this week. And then on the next page, our outreach activities, we really want to push this request a vaccination event. You'll see the URL that you can go to, the link to request an event to come to your place of business. If you run an apartment complex, an educational facility, a community group, we really want to be able to get these vaccines to where people are and where they want them. So the link on that page is where you would go and sign up your business, agency, etc., to try and get a vaccine to you. On the next page, you'll see what we have been able to do for our mobile clinics. We have already completed, well, the Clinic Bay Yacht Club wasn't really a mobile clinic, but it was more of a pop-up clinic targeted toward a key population. So that one was successful. We just finished one with the Samaritan mobile bus down in the Yachats, and it was completely filled. There were only a few walk-ins, and there was demand for it to go down there again. So we're looking at how we can do another event down in that area of the county. The Port of Toledo has an event coming up this Wednesday evening. There are signups on our site or walk-ins. We're allowing walk-ins at any of our clinics right now. We started some pop-up clinics at the high schools. That is continuing. We're planning that with the schools, and Jessica Hubbard is taking the lead for HHS to coordinate with them, as she's our school-based health center program manager. And we've also received inquiries through that link I showed earlier from the City of Depot Bay, from some homeowners associations, an apartment complex, and others, but we need more. We've only had a few requests. So hoping to get the word out to everyone that if you need something at your business complex, let us know. We really want to get this out to the community. So I might be bringing this up every week until we can get everyone vaccinated. And then on the next slide, I start to show you the clinics that we do have planned this week. We got 4 booster clinics started. Right now. Okay. And then I already mentioned about the school district. Select is continuing their drive-through clinics. And I heard they might be expanding that to another area. I don't know for sure yet, but when they do, they'll be sure to announce it. And we'll share that information on our pages as well. And then I have added a calendar. We had a request to have a calendar set up for the clinics coming up this week. So if you scroll down to the next page, you can see a calendar list of all of our clinics. This is on our website now on our COVID vaccination page. It is clickable, so you can expand it so you can actually read what it says. So you can see on Wednesday, we've got a clinic up at Taft, the Port of Toledo one, and then at the County Commons, we have a second dose clinic, but we are just putting them on here because they're open to walk-ins. And if you can make it in and we have a vaccine available, we're going to get you the shot. We're seeing a lot of blank spots in our schedule. So we just want to get people the vaccine where they're at, when they're ready. So if you just show up, we will get you the vaccine. We've been given a little bit of leeway from the state so that if we had, let's say, 4 people show up and we had to open up a vial that serves 6 people, we can still open up that vial even if we can't get those other 2 in there, because the goal now is to get people vaccinated as they show up to us and not turn anyone away unless we literally do not have the vaccine for them. So that's good. Hopefully that will be less no's when people show up at the clinics, because we used to only open the vial if we had enough people. And sometimes people got turned away at that point. And then you'll see on Friday and Saturday, Samaritan is still having their clinics. They have also seen a reduction in the people showing up. So the times are changing now. On Friday, they will accept walk-ins from 12 to 5:45. So they're limiting those early morning hours now. And then same thing on Saturday, and that's the one across from the hospital in Newport. And then up north at the Coastal Clinic, they'll be running from 8:30 to 2:45. Again, all of these you can walk in, and we really want to get that word out that if you can't schedule and you're not sure how to use the scheduling programs, just show up. We'll do our very best to get you a vaccine. We've been waiting a long time to say that, and now it's just whatever clinic you can get to in Lincoln County, we will get you vaccinated. So, and the last slide I have is about our communications. We're going to be meeting tomorrow to brainstorm additional strategies as we move into this less demand area. We're going to be looking at how we can get the vaccine out to people, how we can reach those who may still not know about how to get that vaccine. And then we know we need to target groups that are 64 and younger, but with different strategies depending on what generation they're from. So we're going to be planning those. And also looking at how we can help those who are unsure about getting a vaccine feel comfortable with the decision that they make, that they've had all the information to make that decision. And that's the end of our report today.
All right, thank you, Susan. Questions or comments? Commissioner Jacobson.
Yeah, thank you, Susan, for presenting to us. Always appreciate getting the information. I hope that, first of all, back to our risk category, I think since the governor announced, certain counties, not ours, were going into extreme risk, that there's just been a lot of confusion about that. I had lots of emails last week about, what category we were in. So I have not gotten the official email from the state yet this week, but it looks like from the data that we're staying in high. So hopefully that will, give people the information they need in our businesses. I'm really glad to see in vaccines that we're at the point now where we can take walk-ins. I really think that's going to help get a lot of our workers in. Additionally, when it comes to requesting a vaccine clinic, I think maybe there's some groups that need to be reached out to if they haven't been already, rather than waiting for them to contact. And, one is Nye Beach and the Bayfront in terms of their workers and restaurant workers that are there. I don't know if they're necessarily super organized where one person is going to be able to fill out the form for everybody that works in the Bayfront, but it probably would be a good idea to reach out to them to see if something could be added. The other thing I think about as we move forward into reaching people where they're at is perhaps at some point looking at some type of mobile thing, neighborhood by neighborhood. We do already have data from OSU and the TRACE project that kind of chopped up at least the Newport community into neighborhoods and put in vacation rental data, so we know that those aren't residents or that kind of a thing. But I think as we go on in this, the door-to-door approach does have some merit at some point. So those are just my thoughts. But I'm really happy to see that our vaccination rate is so high, and hopefully we can have some normalcy here. But we kind of have to finish getting through this first. So just appreciate the hard work, and hopefully we're getting there.
Thank you, Commissioner. You're right on with the outreach to the businesses. I know that Amy Snyder, who is our outreach coordinator, has a long list of businesses she reaches out to directly, but I will share your suggestions just to make sure that we've included those on our list. And you mentioned, oh gosh, what was it? The second piece you had? Neighborhood. Neighborhoods, yes. Okay, so we actually are getting zip code data from our epidemiologists that we share with Benton and Lynn County. We have a prototype of that data, and it will break it down by zip code, what percentage has been vaccinated. That will further help us target what neighborhoods, what areas that we need to really focus on getting clinics to. So, and we've also heard from some of our residents that where they were from before, they actually were used to those vans coming around with the loudspeaker saying vaccines or something like that. So we're looking at all kinds of options, and I'll be very happy to take that back to the team.
Great, yeah, sort of like a modern day ice cream truck, but with vaccines. I don't know if it's quite as exciting. Yeah, thanks, Susan.
Commissioner Hall.
Thanks, Mr. Chair, and thank you, Susan, for another really outstanding and very informative, and at least as far as Lincoln County is concerned, mostly positive and hopeful report. I did have one or two questions along the way, but you ended up answering them as you went. This outreach problem is a challenging one, and I can tell you're already ahead of the curve, and thinking about the low numbers among 20-somethings, and I wonder, I imagine part of the problem is that when you're in your 20s, you think you're immortal, and then also somebody, in their 20s today was born in the 1990s, and I think back to my experience as a 60-something, fortunately, polio had been conquered, but the memories of iron lungs and children's in wheelchairs and braces was still fresh. We were only a few years away from years when 50,000 children a year were hospitalized with measles, and 500 of them died. I still carry my smallpox scar, as I imagine Commissioner Hunt does as well. But, for young people, all of that is ancient history if they're aware of it at all. So, I've just been thinking that it's a real challenge going to be a real challenge. And I know you'll find the best approaches possible to help the 20-somethings and eligible teens see that, yeah, this is a proactive step that you really do need to take to protect others as well as yourself. So thanks to you and the team again for all the great work.
You're welcome. And if you want to help us all feel much older, those 20-year-olds are also now born in the early 2000s, as I learned recently, with my daughter turning 21. And as far as the teens and 20-somethings, you're absolutely right. They don't really use Facebook. We can't use TikTok as a government agency because of its archival rules. But the main questions we're trying to answer for them is, if my friends didn't get that sick when they got COVID, why would I get a vaccine? And addressing the question of, if I get a vaccine, I still got to follow these limits, so why bother? So we're trying to come up with some different ways to reach out and explain why it is necessary to get the vaccine, even if you're younger and not usually affected by the illness. Thank you.
Well, I made a remark chiding my fellow Commissioner Hall that I was, earlier in the meeting, I made the remark that I was the older, and I do remember in the 50s, people worried about getting polio. I was living in Minneapolis in the University District. I was old enough to hear people talking about people that they knew had gotten polio, and again, there wasn't a real clear understanding of maybe how the virus was transmitted, kind of like the beginning of the COVID virus. And the fear was real. And if you really want to, I think, get a visual image of the impact of polio, Google an iron lung and look at a person that is in an iron lung, and the machine forces the person to breathe so that they can stay alive. But like polio, a vaccine came along. I remember taking, I believe it was 2 sugar cubes, kind of like the COVID vaccine, the initial dose and the second dose. And, polio's almost virtually wiped out in the entire world. Rotary has worked on eliminating the virus, and I believe is pretty much eliminated it. And I believe the last few cases were in Pakistan, maybe Afghanistan and Nigeria and Africa. But, vaccines do work, and I would encourage everyone to take an opportunity to get a vaccine. And with that, Susan, I believe the county started a new messaging campaign I remember correctly, it's mask up, wash up. I'm not sure the third space.
Back up.
Back up. I couldn't get that. Back up
Yep.
and then backs up. So,
That's right.
Again, a lot of good information presented today, and I think that's a reflection of the outstanding job that our public health department has done and our partners in wrestling with this virus and trying to do everything we can to limit the spread. So, Commissioner Hall, I see your microphone's on. Did you have something to add? Now you're muted.
Well, it seems like either I'm muted when I want to talk or unmuting when I don't want to talk. Sorry about that.
That's all right. Well, I try to recognize the green microphones when I see them. But again, great information and the trends, knock on wood, I'm pretty superstitious, but the trends certainly seem to be continuing in a positive direction. So thank you for the report. All right, if there's nothing more on the virus, we'll go to the Echo Mountain Fire update. And is that Council Belmont or Director Kenyon?
Wayne Belmont, County Council, and I'll start off and then turn it over to Director Kenyon and others who may want to weigh in. I guess I'd like to focus this week on the fact that we continue to talk about the survivors and what we're doing up there, because we're really heavily into the recovery and rebuilding stages at this point. And from our perspective, that's a lot of activities that our folks are involved with the community up there. But we're also trying to really see what kind of funding we can find out there to assist in that particular process. And this funding is provided both on a national level through FEMA, through our legislative delegation in Washington, D.C., and then at a state level through the state legislature. And to assist us in that process, we now have an agreement actually funded by some money provided by the state with the national firm of Ernst & Young. And they are actually very experienced in both wildfire recovery activities, but also COVID. And they're assisting us on both of those fronts as we look to get the maximum number of resources we can to help our community in the recovery and rebuilding process, and also to continue the fight against COVID. So they're on board. They've been talking to our elected officials, department heads, and will be assisting us for a period of time here in our needs for that particular area. We're also looking at trying to increase our infrastructure so that we can actually improve our ability, both as a county and as a community, to respond to fires in the future. So we're not just looking at the immediate needs that we need for recovery and rebuilding, but also long-term. And so that's become a major focus in our efforts now. And that includes some possibility of getting funding for mitigation planning, some other hazard mitigation activities that we have had funded, and then continuing to support our community as we go forward. The last thing I'd like to note is we do have the core team, the Community Outreach and Recovery Education, which has been providing a lot of great service directly to survivors of the Echo Mountain Complex fire, and doing it out of the Grange up north. And we're looking at ways to continue their efforts. It's a challenge, both in terms of the funding and financing of that, but also getting people on board to help us keep that particular program going. And so that's continues to be a focus in both the near and long-term future. And with that, I'll turn it over to Director Kenyon, and I think possibly Commissioner Jacobson also has some updates.
Good afternoon, Commissioners. I'm Roy Kenyon, Lincoln County Public Works Director. This week, Kenyon Excavating, which is the contractor that ODOT hired to do the debris cleaning, they are actually going to be taking, it sounds like, about 2 weeks to back up and kind of be in a holding pattern while the inspectors have a chance to basically check each lot that has been cleared to make sure that they actually pass. They're looking for, metal content, basically everything that needs to be cleaned up off of the lot. I guess there's been some that they've had to return to re-scrape. They're to that point where they don't want to pack their bags until they know that everything is done on each lot. And so the clearing of the debris has outpaced the testing. And so they're going to take a break, basically a hiatus, allow the testing to catch up. There are a few lots that still have to be cleaned, but they're going to bunch them all together and make that one last push. And then they will be done with the cleaning of those lots in that Echo Mountain Fire area. And that's kind of it. I think we can see the finish line.
All right. Commissioner Jacobson, anything to add?
Yeah, one thing I would add is there is an ask right now for proposals for congressionally directed spending, previously known as earmarks. Now this is a new name. And so I am working this week on getting some asks into Murphy's office for wildfire recovery stuff, and I guess more to come on that later.
Okay. Questions or comments, Commissioner Hall?
None at this time, just appreciative of the ongoing good work to continue to move toward the path of recovery.
Commissioner Jacobson?
Yeah, actually, one more thing I just want to say thank you to, and they're not on the meeting today, but just a big thank you to Jack Whaley and his team, who has become our water delivery people out to Otis and over to the Grange, basically providing drinking water to survivors out there. So just a big thanks to that crew. Not only are they delivering water, but the people out there have kind of gotten to know them and enjoy them, and always tell me about how much they enjoy seeing the crew, come up in the county truck with the water. So just a big thanks to them.
I think another example of unexpected duties or responsibilities as a result of the COVID pandemic and the fire. So again, a shout out to facilities for their efforts there. I really have nothing to add. I think I will tell Director Kenyon, one of the nightmares I have, I used to be a runner. I now walk. My knees are much happier that I walk instead of run. But every once in a while, I have this nightmare about coming up to the finish line, and the finish line, I never quite get there. So I'm confident that the county will get to the finish line when it comes to the wildfire and the challenges that we have there. So a good report, another good report. So anything else on wildfire? All right, thank you. And we'll move on to an STR update. And I expect we'll have a lively discussion, and start it out, Council Belmont.
Thank you, Commissioners. Wayne Belmont again, County Council. And we're hoping to get some direction from the board today on the various recommended changes to the short-term rental licensing program that we've been discussing over the course of the last period of time. And just a reminder that we held 2 workshops related to the specific proposals we have here that had about 275 participants, and over 100 people actually presented to you with information. Since that second workshop on April 7th, and really just preceding that workshop, we've had another 105 comments that have been made, 105 plus comments that have made to us. And I'd really like to thank folks for providing the input here, and especially at your request, they've been focusing in on the specific recommendations we have here to help us try and flesh those out and see what we can do to make some what we think needed changes in the short-term licensing program. So what I'd like to do today is just go back to those 4 particular recommendations, go through each one. I'm not going to go into any detail with the actual recommendation, but rather what I'm looking for is some direction from the board to say, yes, this is something we want to do, and yes, please move forward with developing the specific code language and the specific provisions for how we would make changes to the program. And so I'm going to start off by, I'm going to change the order around a little bit, but see if we can't have these discussions on these particular topic areas and see if we can't move this forward. So the first one I'd like to discuss is septic systems or on-site waste management changes that we've proposed here. I'm going to note something that actually I think applies across the board for the changes we made here, because I think it's important to note a difference between short-term rental usage of properties and what we're seeing with other residential uses of property. I provided you with some statistics based on census data that said that the average household size in Lincoln County it's not 2020 data, but the most recent available data prior to that, it's 2.25 persons per household. Well, I did some calculations with the assistance of Lisa Combs from the Sheriff's Office on STRs and found some interesting stats there. And what we have for an average occupancy, and this is not, obviously this is based on what's approved in the licensing program with the current occupancy limits we have. What we have across the board with the approximately 585 units, and this is a point in time examination, but 585 units is the average occupancy that's allowed is 8.3 persons per household. So you can compare that to the 2.25. It's a little higher in sewer areas, obviously. They have more capacity. It's about 9.2 persons in sewer, but even in the septic systems, it's very close to 7.8 persons per dwelling that's authorized on average. You know, and obviously there's some that are higher and some that are lower than that for each of these units. So I think that's important information to have as we discuss a couple of these recommendations. Otto Husing and his team, Brian Crawford, I think Vanessa Howard and Lily Glasgow are all here from planning department, so they can talk a little bit about the concerns that we have with septic systems and why we're making the recommendations there to do an ESER, which is an existing system evaluation report for each of these units, and then some ongoing mechanism to maintain and review the system. So I'm going to turn it over, if I can, to Brian for a couple minutes just to give a brief update.
Hello, hopefully everybody can hear me okay. Thanks for the introduction, Wayne. Yeah, we've been putting some information together just regarding septic systems and potential impact from STRs. When I first got on board here a couple of years ago with the county, one of the figures that we put together that still tends to hold true is failure rate for STRs is roughly 50% higher than it is for your residential occupied type dwelling. A couple main reasons that cause failure to a septic system is one is hydraulic overloading. You know, hydraulic overloading is just too many gallons per day for a system. All systems are sized based upon a number of bedrooms and per state rule. And if you hydraulically put too much water in them, they're just not going to be able to accept it. You know, it's really that simple. The other thing that hydraulic overloading can cause is surge events. So a septic tank is meant to hold the waste for a given period of time. If you drop too many gallons into it, it's going to force those out into the drain field. That's one of the reasons, obviously, for premature failure as well, because the sewage hasn't had a chance to condition, if you will, for the drain field to be able to accept it without plugging up the drain field. Those surge events can lead to stuff such as groundwater contamination. When we send untreated sewage out to the drain field, if there's any high groundwater table, it can impact that. So one, I want to focus on two things. One is hydraulic overloading can cause a failure, just too many gallons, and send untreated wastewater out to the drain field. Two is the lack of maintenance. You know, most literature recommends that a household gets pumped every few years. You know, the solids stay in the tank. They have to be taken out just like they're physically put in. And a lot of a lot of potentially, if we're surging these tanks at an STR or using excess, say cleaning materials, stuff like that from when one shift to the next comes in, that maintenance aspect could cause or lead to premature failure as well. So those are the two big primary factors for failure. What is the significance of failure? Obviously, public health. You know, you could have open sewage accessible to anybody and everybody, including those that use the facility. And then there's always a chance that if we are sending excess wastewater out and untreated wastewater to a drain field for environmental contamination of groundwater, etc. I want to keep it brief, just give you an introduction on kind of what some of the concerns are with that, and I'll stand for any questions.
Any questions at this time, commissioners?
I do have some questions. So first off, when you talk about a failure, does that mean that it needs a pump out, that it needs an entirely new system, or is that anything that temporarily or permanently makes it not work?
Usually, yeah. Failure is kind of defined as just a failure to accept wastewater. So usually when it starts to fail, it will do one of two things. If we wait till it fails till we pump it, it's too late. And the reason is you've already sent those solids out into your drain field. It's not your septic tank that fails, it's your drain field that fails. And so when we get to the point where we actually have a failure, we're talking about one of two things usually happens. It will surface on the ground. I mean, it always goes to the path of least resistance. You know, gravity has worked for a long time and it will continue to do so. It will either surface under the ground or it will back up in the house and come out of the toilets and shower and everything else. So one of those two events will happen. And that's what we consider a failure, is a failure for the system to accept wastewater.
Okay, thank you. My second question is, you said that you see about a 50% higher fail rate and SDRs, but like, what are we talking about here? You know, like, because you had 2 in regular homes and, 6 in SDRs, that would be 50% more. So like, how many are we talking about?
Well, we just took it was a sample size, if I remember correctly, of around 60 systems, STRs versus homes. And I don't, like I said, it was when I came here, first started here a couple of years ago. But if you ran the numbers on the percentage of failures within those, it was 50% higher than we had for the standard dwellings. And again, that's a small sample size. I don't remember exactly if it was what the ratio was, if it was 10 to versus 20 on either side or what. But
okay, that's helpful. And then, my last kind of question is, we've heard from, neighbors of SDRs that, and you kind of touched on this a little bit, but I was hoping you could elaborate a little bit, the concern that it's not just simply, the load or how many people are using that system, but kind of this start and stop. So you have, 10 people in a house for a week and then it's not rented, for 2 weeks or something like that. What kind of problems does that create?
It creates basically two problems. One is the surge event, like I talked about, where it's, we don't use it for a while, then we send excess, not just liquid, but, garbage disposal waste, whatever that comes out of there. Septic systems, anaerobic or aerobic, aren't able to break it down quick enough. Secondly, kind of what it does is, a lot of the systems we have now are aerobic treatment units. They're the ones that have the aerators and the pumps, and they treat it because our lots aren't big, we don't have a lot of space, high groundwater, environmental concerns. A lot of those systems, they do best when they operate at a constant rate throughout the course of the year, like, a lot of households do. If you surge those and then you shut them off, and you surge them and shut them off, it takes that aerobic bacteria time to rebuild itself. I mean, these are biological living systems, and it takes some time to get that bio back up and to properly be able to digest that waste. So in essence, instead of feeding them a constantly throughout the course of the week. We're starving them, killing them off, and then overloading them, and then starving them, killing them off, and overloading them. And that's kind of what the cycle is, and that's why you can get untreated wastewater out to your drain field. Those systems as well have a reduced, they're 40% smaller than a standard system. So if we do that, because of the fact that they produce a lot higher quality effluent, it's easier to get rid of. It's more like tap water versus pea soup, if you will. If we do that a lot and constantly, and they're already sized smaller, because they're supposed to produce a high quality effluent, you could have an increased failure rate on those as well.
Thank you. Do you see similar kinds of issues with this kind of surge problem with second homes? I mean, where people aren't there, and then, you know, come for the weekend or whatever?
You know, I've never been asked to pull any information on it, but I can tell you that anytime I'll back up. When I lived in Idaho, I worked with some of the people at the EHSs in Sun Valley, great big mansion homes, and they would have these surge events very infrequently, or like a guest home, and it did cause a higher failure rate on those systems. Do I have a lot of data to support it? No, but you know, again, you know, they're only meant to take so much, and they're meant to take a certain quality of wastewater. If we put too much in, we don't give the biological fauna the time to do their work, it will cause failure. It will help lead to premature failure.
Thanks. That's all the questions I have. I appreciate the expertise.
So Commissioner Hall, if I may, I'm going to jump in and follow up that comment by Mr. Crawford. You were talking about following up or addressing Commissioner Jacobson's question about second homes. But generally speaking, a second home is probably going to have a more standard number of residents than an STR. Is that a reasonable observation?
Yeah, and to elaborate further on that, which I probably should have, it will be. It will be more, it will be, you're correct. And the second thing is if we do have a second home on a property, they usually have their own system. And if they don't have their own system, if they're connected to, say, the parent house, if you will, when we permit that, we size that accordingly for that. You know, we just don't do 1 3-bedroom and one bedroom, if you will. I mean, we just don't do the 3. We make sure that if we're going to permit that it's sized accordingly to handle all that flow. Whereas an STR is just based on the number of bedrooms. It doesn't take that extra into consideration.
Commissioner Hunt, if I may, I think you were asking about a person's second home, right? They live in maybe they live in the valley.
Yeah, a vacation home, not a secondary home on the property.
And not this vacation home.
I apologize, Commissioner.
Oh, no.
You can see some of the same effects, you bet. Sorry.
I'm sorry, I missed that.
I apologize. I misunderstood you. Yeah, you can see some of the same thing with people that have a secondary home and they don't use it very often, and they come in and you know, they occupy it.
Well, not to belabor the point, but as I evaluate the situation, an STR can have, you know, 8 people, 10 people, a large number of people come in and then leave. So the fluctuation in the number of residents would be far greater, or the volatility would be far greater than you would expect to see in a vacation home where people, you know, bring the family and that's 4 people. Or maybe it's just a husband and a wife, 2 people, versus the much more volatile number of people that would be expected to visit STR.
I would agree with that, yes, Commissioner.
Okay. Sorry, Commissioner Hall.
No apologies needed, Chair Hunt. I don't think I've got any questions at this point. I just want to say I really appreciate this information. It is going to be invaluable to me. I know that all 3 of us have received hundreds of contacts from county residents about all aspects of this topic. And I've tried to review every single one of them, as I imagine both of you have as well. But, it has these our proposed directions started emerging. One theme I've seen repeatedly from STR owners or managers is, well, gee, why should you treat us differently than you do any other home on a septic system? And I think this is pretty persuasive data that, such a differential approach is justified. I mean, in a perfect world, we'd probably be providing greater oversight of all septic systems. And I know that's just not a local problem, but given the particular vulnerabilities of SDR septics, I think, I hope people listening will take note of this. If any local media is listening in and is going to be covering this, I'll just say, everyone, please take note.
Commissioner Hall, can I just say one quick add-on to what you said that?
No. Oh, I think we're Director Houston.
The clear, yes, it's clear what we've learned. That the data is very compelling. A lot of these systems have failed, and the numbers of failure that are substantially higher. But one of the good news is that because of this has been such a challenge to try to with our staff to be responsive to the sheriff's office on making sure that we got the right bedroom counts going and everything like that. I think it has the impact of the vacation rental industry has enhanced our ability to understand what's happening with all septic systems in the county. And the good news is that we are definitely, there are a lot of, so when a system fails, there's a good news story involved with that. We're very often getting it replaced with a modern system, and Brian touched upon this. We're replacing it with a modern system that really should have been installed in the first place, because some of these really nice places that these vacation rentals exist in were developed decades ago. And that's why we had that existing system report up front, because there are cases we don't even know what's in the ground. And yes, when the toilets back up and there's septic on the ground, that's when we're obligated under state law to come in and require an upgrade. But this whole vacation rental stuff too, I think is had a positive effect on the entire program. But yes, your point about the facts are clear that vacation rentals, for all sorts of reasons, place tremendous demands on those systems. And that's what we're trying. And even a lot of responsible members of the vacation rental industry that I've heard and that spoke with me said, yeah, let's make, if those are problems, let's get them addressed. Let's have the oversight and tackle it. So thank you for your question. I just wanted to amplify that it's had an impact across the board in a positive way in Lincoln County, because these failures also mean we're getting systems that probably have been dysfunctional, even though they haven't presented themselves by backing up in the toilet or on the ground. They're still discharging sewage potentially untreated near our waterways. So I want to thank you for that opportunity of adding that.
So if I might, Commissioners, to frame this a little bit for your discussion and maybe give us the direction. What we were talking about again is to do an initial existing system evaluation from a qualified professional to evaluate several things. First is the system properly operating, to acquire any deficiencies that are there to be cured, but also to give us then information on the capacity of the system so we can utilize this information in determinations of capacity for the specific licensee. And then the second component of that we've been having a lot of internal discussions around is, all right, once you've got that initial evaluation report, what do you do in terms of periodically checking back in to make sure the system still operates, to do maintenance requirements? And that's the element that we're working on internally here. But before we go any further, we really wanted your direction to say, one, septic systems, changes to the septic system requirements that we have in the code are something you desire. And then two, have us go forward and develop this specific plan. I will tell you this, one of the things that Lily, Vanessa, Ano, and Brian and I have talked about is we also have to look at the capacity of our professionals out there. If all of a sudden we're requiring all these existing system evaluation reports and then ongoing maintenance, we need to do it in such a way that staggers the workload there to also meet the capacity of our professionals to provide that information to us. So that's another component part that we need to develop and put together here with our final recommendations. But today we're looking for some direction to you. Do you want us to move forward in this particular area and come back with very specific language and recommendations?
Commissioners, Commissioner Hall?
So at this point, Mr. Chair, are you looking for, like, should we just individually give Mr. Belmont a yes, no on these things?
Well, I think that's what he's asking for. I don't think we have anything formal to take a vote on, but by consensus, I think Council Belmont will get direction to develop additional language for our final review. Correct me, Councilor.
No, that is correct. Thank you.
So, Mr. Chair, then I would say, yes, I do want to see proposed changes in code regarding STR septic systems and would like the board to direct staff to work on specific language for our consideration.
Commissioner Jacobson, your thoughts?
Yeah, I have two thoughts I'll share. The first one is I am in favor of this. I want to make sure that we create a rule that is able to be followed. And this is kind of following up to Council Belmont's comments about needing to really connect and vet a plan with professionals. Because what I don't want is creating a rule that then, the contractors can't keep up with or whatever, and then there's no way for you to comply. So I really think it's time not just to maybe get us language to consider, but actually have that conversation with professionals, to make sure the capacity is there to do what we're possibly going to be asking people to do. That's my first comment. Move on to my next sticky note here. My second comment is kind of a yes, but. So yes, again, I'm in favor of seeing some specific proposals and language around septic systems and STRs, but most of the unincorporated parts of the county are on septic systems with a few exceptions. And I, having connected with Brian previously and actually did right along with code enforcement where Brian was there testing septic systems, not on an STR, but a residential home. We have some waste issues in this county, which I'm sure Brian is aware of and others. And even though the comment was made that, 50% more of our septic failures on an STR, we're still having failures on non-STRs. And that's super gross and creates an environmental problem and a health and safety problem. So I guess my yes, but is that I would like the county to also start thinking about and bringing us back some things to consider about getting a better handle on septic systems on non-STRs. Most of the process we have now is complaint driven for non-STR properties. And I would like to start having discussions and thinking about how we deal with failed septic systems in a non-complaint driven way. If there's some other ways to be more innovative and getting ahead of that until we have a failure. So that's my yes, but.
All right. I would say yes, I would like to see language, and I would say yes, I would like to see some kind of an ongoing inspection evaluation process. Back to you, Counselor.
Thank you. That gives us direction on that recommendation. So the second recommendation I'd like to talk about sort of goes with that, the septic systems, but it's beyond that, and that's the occupancy limits changes. And again, what we discussed was changing the current 3 persons plus 2 additional persons to 2 persons plus possibly an additional 2 people. And then talking about whether or not we allow events at STRs and whether or not we do something different between daytime and nighttime, and whether or not we actually set these as basically static limits on the number of people who can be there at any time. You know, no matter what's going on, you could not have friends or family come over during the day. I've had further discussions with the code enforcement folks on these particular matters and their discussions around doing this. They are basically, they would like to see us do something that we can manage from a code enforcement standpoint. So they would not like to see the difference between day and night times. They would like to see just a static number that we come up with, the persons per bed, something that they will enforce at nighttime only. They're fine with saying no events. That would be okay. But I think the real change that we're looking for here is, do you want to make a change from the current limits of 3 persons per bedroom plus 2 down to 2 persons per bedroom plus 2? I will note maybe just one last comment is this is the one that you know, I think what we were saying is there probably is no singular change you would make in the code that will have more impact on really the ancillary issues that we have, which is parking, garbage, noise, those kinds of issues, that by reducing the number of persons that are in a home closer to the average household sizes in the area already, that in and of itself should lessen the problems that we're seeing with STRs.
Well, I'll ask a clarifying question. Are you looking for just guidelines as to reducing the number of occupancy, or
Yes.
also looking for guidelines as to duration of that occupancy during a particular day or week or month or year or other period?
I think we're looking at first just the question of, do you want to change the occupancy limits that are currently in the code?
Okay, I'll say yes.
I'll also say yes. I mean, as has been discussed many times, 99% of the complaints seem to be noise, garbage, and parking. And those problems almost always seem to be exacerbated when there are a dozen or more people in an STR.
Commissioner Jacobson.
I would agree. I also want to see a proposal on this, and clearly it needs to also be connected to, you know, septic system issues, which is what we were just talking about as well.
Yeah, and I'll say that I agree that this is probably the single most change that we could make in the code that would have the most encompassing impact on this challenge of STRs. I do believe that there's probably, or I would support some kind of a, frankly, that's the limit regardless of the time of the day or the day of the week. But that's my thoughts. Anything else before we go back to Council Belmont? Okay, back to you, Mr. Belmont.
The other thing that we will do related to occupancy is we do have some grandfathered units, and we want to explore that a little further and come back to you with a proposal that also addresses the grandfathered units too. You may recall that was done when we first initiated the code. We grandfathered it. It turned out that there was less than 10 units that were actually grandfathered, but we want to at least address those and come back to you with some recommendations related to those.
How many grandfathered units are there now?
I want to say, I haven't looked at it recently. I want to say there's 8, somewhere around 8.
Okay. Commissioner Hall, your microphone's green.
Yeah, and just for the reference of people listening in, we're talking about these units that, if I remember correctly, were grandfathered at higher than the current 16-unit maximum because they were able to provide sufficient off-street parking for that occupancy number. But yes, given the septic issues, some of the other things we've been dealing with, I think a fresh look at whether that grandfathering continues to be appropriate or not is warranted.
Okay, thank you.
Commissioner Jacobson?
I'm not sure where I'm actually at with grandfathering. I guess I need to kind of think about that a little more, but I am in favor of bringing some specific language back on reducing the occupancy overall, and I'm a fan of a straight limit rather than limits at different times of the day or whatever, which would be very difficult to enforce.
All right, I'm certainly in agreement on that.
Great, thank you. So the third recommendation dealt with additional code enforcement options. And specifically, we talked about creating an administrative process to hear and address complaints. The sheriff, I don't see the sheriff was able to get back on. He had another conflict today, but he wanted me to pass on to you that he is extremely supportive of that particular recommendation. And he and his office will be very involved as we put together the administrative procedures on a go-forward basis. And so this would not change necessarily the current code enforcement options. It would add additional options there. It would give us some tools that we think could address some of the concerns that we've been hearing. And if there aren't concerns, I think it works both ways. It's also that to the extent that folks are saying that, some of these issues are not really issues, they're not complaints. People just complain without having a basis for doing it. It'll give us some tools to handle those particular situations also. So with that, I'd like to take any questions you have on setting up that additional code enforcement option.
Well, I'll go first since I don't see a microphone turning green immediately, but I long have been a proponent of enhanced enforcement.
I would agree with Commissioner Hunt, and I think we really need a framework for what enhanced enforcement means. What is a strike, what is not a strike, et cetera, et cetera. I would also say that one of the alarming things I'm starting to see is people that will take photos of a situation but not actually report them, and then send them to us several days later, as a complaint towards this process, but never actually reported the incident in the first place. And so I'm not exactly sure what to do about that, but people obviously need to report things, as they're happening.
Yeah, I'm totally with both of you on this one. Definitely, I think Mr. Belmont, in one of your earlier presentations to us, you pointed out how this is kind of taking the original framework we established in 2016 and really adding the missing piece, the next piece. So definite yes for me.
Well, if I remember.
Go ahead. Sorry.
I was going to say, and I remember in previous conversations, we talked about some kind of a hearings officer so that violations could be addressed in a similar process as dog complaints or dog violations.
And that would be the kind of procedure we'd set up that would have evidentiary standards of review, decision-making requirements, and address the issues that Commissioner Jacobson was also raising.
Yep. Sounds good.
So it sounds like consensus to move forward with that. Okay.
I'm seeing heads nod. Go ahead.
That brings us to the fourth recommendation, which I have left for last, and that is a cap on the number of licenses to be issued. And as you may recall, we provided you with 4 different kinds of scenarios that we could do there. And I think you've now had an opportunity to listen to the public input on the question of whether or not to have caps in the first place. And that's, I guess, the first question I would pose to you. Do you want to put a cap or not on the licenses that are issued? And if you do want to do a cap, then is one of these options that are alternatives that we've presented preferred?
Commissioner Hall.
Cap, yes.
Commissioner Jacobson.
I'm also for a cap. I am more in favor of an area-based cap than just an overall number. You know, right now with our, I'm gonna laugh and say temporary cap, which has not been temporary, but you know, that's an overall number. I like the area-based approach better than just an overall number, so that those are hopefully with time a little more spread out and less, you know, dense. Just some additional thoughts on caps. I'm not a fan of having the license automatically transferred to a new owner. I think that should go back into a pool so that other people have to offer that, you know, business opportunity. Additionally, I don't think there should just be a wait list, and when there's an extra license, the person at the top of the list gets the license. I think it should be a lottery type of process with public notice so that people could apply for that opportunity, and you know, a name is yanked out of the hat or whatever. So I'd like that to be more of a, like I said, a lottery process than simply a wait list.
All right, I also in favor of a cap. I would envision some kind of sub-area caps. And I would see that cap not necessarily being numeric, because over time, a number of houses in the different sub areas could change, most likely grow. And so I would be in favor of some kind of a percentage of STRs within the sub areas, and those percentages may or may not vary. Not sure how I feel on that by sub area. And I guess if you're talking about percentages, I think you'd round down to the number, not up.
Mr. Chair?
Commissioner Hall, sorry.
Yeah, that's okay. I just wanted to jump in with a few additional thoughts on the concept of a cap. And I think both you and Commissioner Jacobson have offered some valid observations and points. And here's where I'm coming in. I mean, ideally, I would like to see some kind of overall countywide cap that would allow for some level of growth, but definitely in the number of STR licenses, but definitely subcaps for the areas that already have really heavy concentrations of STRs. So at least in theory, people might be able to get a new STR license, but not in perhaps Area 1 and Area 2. You know, we've heard a lot of perspectives on this from a lot of different angles, and people often bring up the affordable housing issue. And I think everyone knows my passion for affordable housing. And you know, compared to, I believe Tillamook County has roughly twice their rural residential housing stock in STRs as we do. So, you know, I think it is a basic law of economics that anything that reduces the housing supply, takes a home out of the long-term ownership or rental market, can contribute to our affordable housing shortage. But just to make clear, what I hope has already been clear in my earlier comments on this topic, to me, the absolute number one driver for wanting to see us moving in the direction we appear to be moving is quality of life in residential neighborhoods. And when you see the majority of neighborhoods of a neighborhood or an area no longer being primarily owner-occupied homes, I think that has potentially a lot of negative implications. So I think both of these are worthwhile tools for monitoring this. I'm certainly willing to consider Commissioner Jacobson's ideas of not automatically transferring licenses to new owners, and considering the lottery idea as well. Thank you.
Yeah, I would support those two ideas, and I would say one of the reasons I like percentages is that's really concentrations. And I would envision there are areas where the concentration is in sub areas is too high, and there are probably areas in the county, unincorporated areas of the county, where the concentration is lower and would allow for additional development. So. Council Belmont, back to you.
Thank you. I think that gives us some direction. And what we will do to help you with that particular discussion is we'll go back and actually we've got some capability of utilizing both our software system that tracks these particular units as they're out there now and our GIS system to give you more information with the sub areas that we had identified before, what the concentration levels are there. It's going to take a little bit more work to do that, but we'll come back to you with some additional information along with our recommendations in this particular area. But this, I think you gave us some good direction.
Commissioner Jacobson.
Two questions for you, Council Belmont. One is, as far as a process here, I think we were trying to have this done by June. Are we still kind of on target there?
I think we are, in terms of you're telling us now that the decision of whether or not to institute some kind of cap, yes, you know, because by the direction you gave us today, that question has been answered. Now, in terms of the specifics of the code change and what we have to do to get there, we'll see where it goes at this point. So I think all the other changes are pretty easy to put into place and have those done by that deadline. You may want to have further discussion on the cap, but at least you've given us the direction, and that's something we can tell folks who have been asking, you know, are you going to be lifting the suspension out there? And the answer right now is no. As it stands today, you're going to do something different with a cap on the number of licenses.
Yeah, I would say I think more discussion on, you know, the caps, you know, are needed because there could, depending on if we do a percentage, there could actually be opportunity for new licenses depending on how that percentage plays out in areas or sub areas, et cetera. So I think there's some, you know, getting in the weeds that has to kind of be done with this. My second question, I have now seemed to have forgotten, so I will follow up with you later if I remember what that was.
That's fine. Okay. But thank you for all of your directions. I just want to end up by saying, you know, these are the four particular recommendations that we had. And obviously, we're also going to come back with some revised fees, as I've noted. That's been going along in here. Is there any other area that you want us at this point to continue any exploration or additional options for you?
Commissioner Jacobson, your microphone's green first.
Yes, I did remember my second question, which I'll get to in a minute, but I think in terms of other things to explore, you know, garbage comes up a lot. I mean, just like over and over and over again. And I think perhaps that we solved that previously with kind of making ongoing evidence that you still have garbage service required, but I think it's worth maybe looking into if there's other things other jurisdictions have done. Because as Commissioner Hall said, you know, noise, parking, and garbage seem to be that one. And I think the occupancy might deal with some of that, but I still feel like maybe a good hearty look at garbage would be good. And my comment or question I was going to ask is, in terms of public engagement, from this kind of time forward back to a kind of processy question, what's kind of happening next with this? Obviously, people can still make public comments to us, but is there other kind of engagement activities beyond making public comment that are kind of the next steps for all the constituents listening?
Yes, what we'd like to do is once we actually craft the specific language that meets with your approval, we want to put that back out there for a final opportunity for comments from everybody before you actually adopt it. So there will be an additional opportunity to engage the commissioners before we actually have you vote on changes to the code.
Commissioner Hall?
Oh, No, I'm sorry if I don't have anything more at this point.
All right. Well, I would agree, certainly, parking, garbage, and some of those things are a part of the problem. I would hope that as you develop the code and the process for enforcement, some of those issues can be, if you will, woven into the code that can be enforced through the process of addressing violations. But it may require additional separate work on those issues too. And I am using my cell phone, and my cell phone battery is telling me I have 1%. So I'm going to switch back to my laptop audio, which may not be as good, but that's kind of where I'm at. So okay, can you hear me now?
Yes, we can.
Okay. I don't know how clear I am, but I'm on my laptop audio. Anything else, Council Belmont, on STRs?
Nope, I think you've given us direction and we'll move forward.
Okay, I'm not hearing a thing.
We hear you.
Okay, now I can hear you. All right, I assume that was a no, or thank you, or
Now, thank you for you've given us direction and we'll move forward from here. Thanks.
all right. Next on our agenda is Commissioner reports. Commissioner Jacobson, your microphone's green.
I think I'll pass.
Okay, Commissioner Hall.
Don't have anything more today. Thank you.
Well, as my father taught me years ago when I went to the Portland Buckaroos game, make it a hat trick, 3 in a row. All right, next item on the agenda would be public comment. We do take public comment through written process, and we show it 2 different ways. One through the Smart Sheet process, which is in front of us. I will note that I received some public input at about 11 o'clock today on the STRs, and I believe that would be included in the next visual, which is scrolling down to there's combined input through today's date. So that is where public input on any issue can be found that's been sent to the board. And with that, if there's no more business to come before this meeting, we will be recessing into an executive session pursuant to ORS 192.660, parentheses 2, parentheses D, to discuss labor negotiations. We will not be coming back into a public meeting. We do have some meetings scheduled in the future. Tomorrow will be the first county budget committee meeting. That is scheduled for 6 p.m. again tomorrow, Tuesday, May 4th. That will be a virtual meeting, just like this meeting that we're currently conducting. We have a Board of Commissioners meeting on Monday, May 10th at 3 p.m. And we have a second county budget committee, We have HHS director interviews on Wednesday, May 12th. And there will be a quorum of commissioners present at those interviews. So those are 3 meetings that will be held this week and next week. And with that, we will recess into executive session pursuant to ORS 192.660, parentheses 2, parentheses D, to discuss labor negotiations.
Chair, this is Jerry Herbage, and I had a discussion with Council Belmont this afternoon, and we feel that it would be prudent to postpone the executive session, and especially since it's about 5 and it might take some time.
Yeah.
And do that next week, if that's okay with the board. So the reason why that can work is because the next negotiations are set for the 13th. So if we meet on the 10th, we can timely get the recommendations we need and move from there.
Are my fellow commissioners in agreement with that?
No objection.
No objection either.
All right, with that, I am canceling the executive session. And we will have the budget committee meeting tomorrow as planned, and we'll have the Board of Commissioners meeting on Monday and HHS directors next Wednesday. And with that, we are adjourned.
Thank you.
Thank you.